The importance of Q's platform is that it's designed to safely and effectively restore our body's innate capacity to heal in a targeted organ. Well, I had started some cancer treatment centers called Inspire Health. There's now 3 of them. And in that work, I became very interested in how the body's immune system can support healing and how you can optimize immune function when people are taking conventional treatments like chemotherapy or radiation. One of the people I was caring for had advanced pancreatic cancer, and they were close to the end of their life. He'd lost 60 pounds and was in palliative care, not expected to live longer than another week. And he developed a severe abdominal infection. His family chose not to treat him with antibiotics because he was so close to death. And remarkably, he not only recovered from the infection, but he went into remission from advanced pancreatic cancer. And that changed the course of my career because that was like a miracle to see that somebody who was terminal recovering from advanced pancreatic cancer. I asked myself, well, how could that happen? And I began to look through the literature and found that there were many hundreds of similar published cases of people with advanced cancer who developed a severe infection and went into remission. The importance of Q's platform is that it's designed to safely and effectively restore our body's innate capacity to heal in a targeted organ. So we can target that response, for example, to the GI tract or to the lungs, and it functions in a way that's compatible with our body's own healing mechanisms.
So when you think about Q Biologics, in a way you've got to shelve all of your conventional wisdom and knowledge and put it on one side and think differently about how you're approaching disease. You shouldn't think about disease because the Q technology is not about diseases. It's actually about the biology that underlies the host response to the disease. And generally we tend to think we should be working on lung cancer or Crohn's disease, whereas it's not actually the disease you're working on, it's the underlying biology of the disease that you're working on.
Q Biologics is approaching disease in a very different way. What Q is trying to do is restore innate immune function in people to overcome pathology, whether it be cancer or chronic inflammatory diseases. Dr. Gunn was trying to bring to the clinic something that I was really passionate about because I really wanted to be a part of this innovative and novel way of approaching diseases. And I've been working with Hal for the last 6 years, and he's so passionate about what he does, and he's very driven. And I think it's not an easy road to travel, biotechnology, but it's really fulfilling to be able to bring to the clinic something that can be so useful to so many people, not only for COVID-19, but for cancer and chronic inflammatory disorders, and a lot of what ails us today.
We know that much of modern medicine deals with controlling the symptoms. You have pain, please take the pain away. But if you had pain because there was an underlying disease, the real issue is can you get rid of the disease, not can you obscure the pain. And with Q, the underlying ideology is this is not really about covering up the symptoms. Clearly, if you control the disease, that's going to be a benefit. But what Q is really all about is how do you control the underlying problem that gives rise to what the patient is actually complaining about?
It's been a wonderful, I think, happenstance that I was able to connect with Hal because we're very similar in mind in the way we approach diseases and how to overcome them. We think that after treatment should be really building up people's resiliency and their overall health as opposed to making them weaker. So oftentimes you may have heard the cure is worse than the cure, but not in this case. It's really inspiring to be bringing something, a therapeutic, that actually makes people feel better at the end of the day.